Hello, Dr. Tucker here. Today we're going to discuss vitamin D deficiencies. This is another top 10 supplement consideration. Depending on where you live, if you're above a certain parallel, you're not getting a lot of sun exposure for a good portion of the year. And as many people notice, they say there's pretty large portions of the population now that are deficient. Some people estimate about half of the world. So if you have a desk job, if you live in a climate that's cold most of the year or half of the year, you'll notice that lab work has gone up. In the last 20 years, there's been a significant spike in testing for vitamin D deficiencies. Between certain year spans, there's been about 80% or so increase. Just from 2009 to 2014, there was a 2.5-fold increase in testing among Medicare patients. So there's been more attention put on this because vitamin D has been known, if someone has a deficiency, to correlate to certain issues like bone health, like even type 2 diabetes, links to Alzheimer's. A lot of people say if you're deficient, you're going to have certain morning stiffness and joint pain that can actually mirror symptoms that look like rheumatoid arthritis. D deficiencies have also been linked to not just bone health, but significant issues with immune health, immune function. So there's certain times a year where you might want to boost up if you're trying to battle the classic D deficiency for flus, etc. There's some links to weight management and D deficiencies, mood disorders. So there's a lot of benefits to having good, stable vitamin D levels. Now, some additional symptoms, just so you might relate: fatigue, not sleeping well, bone pain, sadness, hair loss, muscle weakness, poor appetite. But definitely if you catch yourself getting sick often, you might want to consider looking into your vitamin D levels and getting those tested.